Hi, my name is Krista Williams, and I'm going to complete the physical exam on my patient. So first I'm going to assess your skin. I'm going to start by looking at your hair. I'm going to work my way down. Okay. I'm going to assess for any rashes, any lesions, any scars. While I'm doing this, I'm also feeling for the temperature. Just going to lift up your shirt here and look at your back for any rashes. I'm going to lift up your shirt here, look at your chest. I'm also looking for any swelling, any edema. I'm going to also look at your legs here. Also checking for any swelling, any edema. No pitting edema noted in the legs or in the feet. Next, I'm going to look at the eyes. I'm going to look at your eyebrows. I'm looking at the eyelids. I'm going to gently palpate the eyelids. Can you open up your eyelids and close them? Thank you. I am going to look at the pupils. Make sure they're equal and reactive. I'm going to shine this light on your nose. You look at my finger. Okay. I'm going to hold your chin. You follow my finger, okay? Now I'm going to move on to your ears. I'm going to inspect and palpate the external ear. Any pain back here? I'm checking for any swelling, any lesions, any abnormalities. Any pain back here? Okay. With my otoscope, I am going to look inside the ear. Now I'm going to whisper some letters and some numbers. You tell me what you hear.
A1, B2, C3. E3, E4, F5.
All right. Now I'm going to examine your nose. I'm just going to inspect the nose, the bridge. Any pain here? Okay. Can you breathe for me? All right. I'm going to have you smell something. You tell me what you smell.
Yeah.
Okay. With my light source, I'm going to look inside your nose. Okay. Now I'm going to inspect your lips. I'm going to look at your gums and your teeth and the back of your throat, okay? I'm just looking at your mouth for any lesions. I'm just going to inspect here for any lesions, okay? Use my light source. Say ah for me.
Ah.
Looking at the teeth. Looking at the gums. Okay. Stick your tongue out. Can you move it to the right and to the left? And can you say ah?
Ah.
Okay. Now I'm going to assess your cranial nerves. Can you smile for me? Can you frown? Can you blow your cheeks real big? Can you blow the air out? Can you raise your eyebrows for me? Can you bite? All right. So now I'm going to have you open up And close your mouth. Open up and close your mouth. All right. Now I'm going to examine your neck, okay? I'm just going to right now look at your neck, see if I see any lesions, any swelling. Look at your veins here in your neck. I'm going to palpate lymph nodes. Any pain? Any discomfort? All right. Maybe tip your chin a little bit. And can you swallow for me? Any pain, any discomfort? Swallow again. Okay. Now I'm going to put some resistance on your shoulders. I need you to push up for me. All right. Good job there. So now we're going to go, and I'm going to check out your back and your lungs. So for this part, if you could do me a favor, if you could swing your feet this way. And I am going to count your respirations. I'm going to listen to the rate and the rhythm of your breathing, okay? You just breathe normally for me. I'm going to count this for about 15 seconds. All right. Great rhythm. So now I'm going to put my hands back here on your back. Once you feel that, I want you to take a deep breath in. Breathe out for me. All right. Good job. Now, can you say 99 for me?
99. 99.
All right. Awesome. Now you're going to feel me tapping on your back, okay? All right. Any pain, discomfort with that? Okay. All right. Sit into this side. And now I'm going to do the front of your chest. Okay. Now I'm going to listen to your back. I'm going to raise this arm and listen to you. Same thing on this side. So now I'm going to listen to your heart. I'm going to start off by listening to the back, and then I'm going to come listen to the front. Then I'm going to have you lay down, and then I'm going to lay you on your left side, okay? Okay. So now I'm looking for the apex. Okay. I'm going for any heaves and lifts. All right, I'm gonna have you lay down. Same thing, I'm gonna listen for that apex. Alrighty, so now I'm gonna get you to lay on your left side. And I'm gonna have you do this one right here for me. Okay. Now I'm gonna have you lay all the way on your back, and I am going to examine your abdomen. So I'm going to inspect the skin, looking for any lesions, any swelling, anything abnormal in the abdomen. I'm going to feel on the skin. I'm going to listen for bowel sounds. I am going to percuss the abdomen. I'm going to lightly palpate the abdomen. Any pain, any discomfort? Alrighty. Since that was tolerated, I'm now going to deeply palpate. I'm looking for any masses, any swelling organs. Okay. Alright. I'm going to have you sit up for me. So now I'm going to listen to your carotids. I'm going to check all your pulses and look at your capillary refills and also check the hair on your legs, okay? So I'm checking the capillary refills. I'm checking for any signs of clubbing on the fingers. Okay. I'm going to start off by feeling carotid. I want to feel brachials. I would also feel the femorals to make sure that I feel those pulses there. I'm going to also feel pulses in the lower extremities. So now I am going to do the musculoskeletal part of the exam. So I'm going to have you touch your chin to your chest. All right. Now, can you extend the back of your head? All right. Can you have your chin touch the left part of your shoulder? Can you have your chin touch the right part? All righty. Look back at me. Can you have your ear touch your left part of your shoulder? And right. Good job. All righty. So now we're going to have your elbow. Can you flex your elbow for me, make a muscle? Can you extend it? Good job. Same thing on this side. Good job. Thank you. All right, I'm going to have you stand up. Can you touch your toes for me? All righty. Can you bend your back as far as it'll go? All right, good job. Now, can you lean to your left? Can you lean to your right? All righty. Now, with your hips planted, can you turn your upper body to the right and to the left? All righty, sounds good. I'm going to have you have a seat, and I'm just going to feel the joints for any swelling, any warmth. I'm listening for any crepitus in the joints. All right. I'm going to have you straighten out your knee and bend your knee. Okay. Straighten out and bend it. Wrist. I'll do the same for your feet. Move your ankles. And I believe this completes our exam. Alrighty, so for this part of the exam, I'm going to go over some of the things that I was unable to assess because of lack of instruments. I also completed the patient's vision acuity with a Snellen chart, and he had a vision of 20/20. I also completed the Rhine and Weber test. With the Weber test, I placed the base or the stem of the tuning fork midline on top of his skull, and I asked him to let me know when he did not hear any sound. With the Rhine test, I also placed the stem on the mastoid bone and asked for him to tell me when he did not hear any sound. Then I immediately placed the tuning fork 1 to 2 centimeters away from the ear and asked him to tell me when he did not hear sound. The ratio was 2 to 1, with it being positive. So for the male examination, the male genitalia examination, I will have the patient the exam can be completed either lying or standing. In particular, I probably would have them lying down. I would inspect the penis, the pubic area for any lesions, any swelling. And then I would go and inspect the penis itself. If it's a circumcised penis, I would look at the gland to make sure that the gland is dry and erythematous. If the penis is circumcised, I will gently pull back or retract the foreskin, make sure that it's free from any signs of infection, make sure that there's no purulent discharge coming from that area. The penis itself should be free from discharge. If there is any discharge, then I would need to take a culture of that. With the scrotum, I am looking to see if I feel for any lumps, any swelling, any pain in that area, to make sure that it is free from all of that. And lastly, I want to check for any hernias. So I would place one index finger inside the skin of the scrotum, and then I would have the patient cough and make sure that I don't feel any pushback or any abnormalities at that point. For the female examination, I would have the patient in lithotomy position in the stirrups,
and we will complete the examination that way. I will start off our external examination looking at the outside of the female region, seeing if I see any lesions, any signs of infections, any discharge in that area, any lumps, bumps from that area. After the exam was completed on the outside, I would then, excuse me, get a speculum, place it inside of the vagina, and then open it up so I can now see the inside and also have the cervix exposed. I should see a clear, smooth, no lesions, no bumps on the actual cervix itself. If I see any signs of infection, I would need to definitely take a culture to see if there's any STDs or anything like that. If I do see any signs of lesions, bumps, or anything like that on the cervix, I would also need to take some samples of that as well with the pap smear. During the female exam, I am also checking for the glands to make sure that the glands are in place, intact, that they're firm. With the ski gland, I would kind of milk that to see if I have any discharge coming from that. If I do, I need to send that off for a culture. I'm also, during this exam, inspecting the vaginal walls, noting the tone, the color, consistency during the exam as well. With the female rectum exam, at this point, I would be doing a manually exam with my fingers at this point. I would place one finger inside of the vagina, and then I would have one finger inside of the rectum at this point, noting that that septum that's they're separating the rectum and the vagina. I would note the tone of that. Could also feel, I can turn the finger that's in the rectum and feel the walls of the rectum, make sure that I don't feel any polyps, any nodules, anything abnormal inside of the rectum at this point. I can also do a bimanual exam with my finger inside the vagina. I can push down at the top to feel the actual uterus. I can move to the side and push to feel the ovaries as well. With the male rectum exam, I can either have him lying laterally on his left side with his legs up, and his knees up, and I can insert my finger inside his rectum that way, or I can have him leaning forward, pressing his weight on the table with him standing kind of bent over in that kind of fashion, and I can also insert a finger and complete the rectal exam that way. Again, I'm feeling for any nodules. I'm feeling for any polyps, any looseness, anything hard or anything abnormal in the rectum at this point. I will also, for the male and the female, I would expect the sphincter. So I would insert a finger in the sphincter. I would have them squeeze down on that muscle, noting the tone of their squeeze. As far as the male prostate exam, I can also do this while I'm in for the rectal exam. I can insert my finger inside the rectum, have my index finger going down so where I can feel the posterior prostate, noting that that should be firm, slightly movable, with little or no pain during that part of the exam. To end the exam, we were in with the breast exam. So for females, they can do a monthly self-breast exam at home. Usually you probably want to do it maybe 2 weeks before the start of the menstrual cycle. You can do it easily in the shower. You can start off by having your hand behind your head just like this and going around in a circle around the entire breast there, going around till you get to the nipple. excuse me, you can also feel down the armpit here. Make sure that you don't feel any nodules that way as well. You will also complete it on both sides of the breast. When the patient comes in for a breast exam, I will have them laying down with their arm extended as well behind their head. And I will also complete in that circular motion going from the outside of the breast, going around, feeling as I move around, getting close to the areola and at the nipple here. I can go down and also do that on both sides of the breast to feel for any nodules, any lumps, any heat, anything that would be abnormal. At this point, I can also assess the nipples to see if I see any discharge. If I do, I need to get a more thorough history to see if this is a lactating mother or if it's something that it should be examined a little bit more frequently with. And I think that concludes my exam. Thank you.